Thank you for having me. And I'm going to share my screen here. I'll keep things brief, just a couple of the highlights. And then, of course, anyone's welcome to reach out to me in terms of follow-up questions or more depth into this. But overall, very quick introduction from my background. My name is Aasim Saeed. I'm a physician and public policy person by education, but now the founder and CEO of Amenities Health. And prior to this, I led innovation at a large healthcare system called Baylor Scott and White Health in Dallas, Texas. And so when we think about the opportunity for patient experience with virtual models, we need to ensure that they are addressing and solving these core points. So in other words, what we often find with traditional virtual deployments is that they don't meet any of these big problem area criteria. Specifically, they're asynchronous. You fill out a form and we send you information. Well, that doesn't help me feel less rushed or that the care was personalized to me or that I felt listened to, right? It's a different provider every time. Virtual urgent care is notorious for this. This is urgent care market is I don't care who I'm going to see. I just want to go there. And you can see from the prior one, a consistent provider is one of the major opportunities or priorities of patients. And traditional virtual urgent care models don't speak to that in any meaningful shape or form. This is my company, Amenities. We really help accelerate the journey towards premium and virtual first memberships. One, we think that if you're going to be changing a paradigm of care, you should also be changing the paradigm of both the payment models and the opportunity for both revenue for yourself as well as loyalty for patients. And so we create a white labeled concierge membership program with large healthcare systems, including academic medical systems, all the way down to single individual physician partnerships. And that this is a market that is incredibly exciting, specifically because while the most providers are facing massive headwinds to the magnitude of $32 billion that's going to be taken out of the industry this year alone in 2026 due to reimbursement deficits from the One Big Beautiful Bill and other ancillary impacts. That is something that could be completely offset with a similarly sized $30 billion premium healthcare market, meaning concierge, longevity, wearables, advanced diagnostics. Patients are paying out of pocket in a market that's incredibly fast growing, so 10% compound annual growth rate to help offset these Medicare and Medicaid losses.